Hi friends, again it's Dr. Vetere and my patient Lizette, and today she has a terrible neck problem, and we're going to work on some stretching and some exercises that can limber up her neck. But also understand this, the neck problem can be more than just a pain in the neck. It can cause pain in the shoulders, it can affect the nerves that come out of the neck and go down the arm. It can also affect the nerves that come out of the neck and go up in and around the head that can trigger off a number of different types of headaches. Now, the first thing we want to do with the neck, very similar to the exercises or the stretches we do in our morning exercise, is to just limber up the neck. So what we just want to do is tilt the head forward, let the weight of your head, don't force it forward, just let the weight of your head hold it down, maybe about 7-8 seconds, then lean it back, and you'll feel the stretching right across your SCM muscle in the front part of your neck. Then you bring it back, and always in between your neck stretches, bring your head back to neutral, okay, in this position. The next one we're just going to do is tilt the head directly to the right side. Now, important, if you look at Lizette's head, it's not rotated, it's just tilted to the right side. Again, 7-8 seconds, we tilt it over to the left side, tilt it over. You're basically bringing your ear to the shoulder, okay? Just allowing the weight of your head to make the stretch occur. Bring it back to neutral position and just tilt your head, rotate your head as far as you can to the right side. Again, hold that. You'll stretch your SCM muscle again and other supportive paraspinal muscles. Then rotate your head all the way towards me, okay? Now, Liz has been a patient for a while, so her range of motion is good. Your normal range of motion in this position, back to the middle, should be about 80 degrees. I see a lot of folks come in and they have very limited range of motion in the neck. I wonder how they can even drive their car because they can't even turn their head. And it's very important to have your spine checked to make sure you gain that range of motion back. Okay? Now, the next part is to build and strengthen the neck muscles by doing a simple progressive resistance exercise. So we're going to start off, get your right hand and put it on your right temple, okay? Not on your eyeball and not on your ear. And what you're going to do is you're going to rotate your head. That means strictly turning it towards the right side against your hand. And you're going to create pressure. There's going to be a resistance. Your head is going to be forcing against your right hand. And hold that for about 8 seconds. Now push against that right hand, and you'll notice just a tension. Hopefully she's making a tension face. There you go. Against the right hand. Okay, and then you relax. Now you take your head and rotate it about 45 degrees to the left side. Put your hand back on that temple area, and now you're going to push again towards that area. But your head doesn't win the fight. It just stays in that angle, putting the pressure towards the right side in strict rotation. Now we relax and we go to the left side. Okay, put our left hand on the left side of the temple. You're going to push 8 seconds against the hand, keeping your head straight, always trying to keep your head straight. Now, you may want to try this in the mirror in the beginning so you can notice that your head has not rotated either which way. Then you relax, okay, turn it about 45 degrees back on the temple, and Lizette's going to try to center it, but never ever get there. Just hold that resistance, okay? 7-8 seconds. Now she relaxes. Always go back to the neutral position. The next motion is going to be lateral flexion or lateral bending. We're going to put our right hand or left hand, start on our right hand, on the right side. This is above your ear, not on the temple now, okay? And she's going to push directly against her hand, holding the tension against her hand. Again, about 8 seconds. Let it relax. Now we're going to tilt our head to the left, okay? As far as we can. Again, put your right hand on that area and push against it. What's happening here is we're going to be stretching out the muscles on the right side of her neck. This progressive resistance causes the muscle to elongate and allow it to become more flexible. Now we go back to neutral, right hand, right above the ear. We're going to push against it, count to 8 seconds, and you can see just by the little tremor or shake, she's putting that, that tension against it. Now, remember I told you earlier, okay, relax, tilt it over this way. Okay, Lizette's a competitive athlete. She played volleyball in high school and in college. Okay, I don't know how she jumped over the net, but I guess she did. And you bring it back to the middle. Now what we're going to do is we're going to do it forward and back. Put your hand right on one hand right on your forehead, and what you're going to do is just put the pressure forward. Again, where you can see the muscles tightening up on the front part of the neck and just allowing it to relax. Now, unlike the other two motions, we don't increase it when we do forward and back, flexion and extension. Just do it one time forward from a neutral position. Our head was straight. It wasn't forward, it wasn't back. Now we're going to get both hands and put it behind the head right here, okay? And now we're going to push back against the hands, keeping the head straight, and we're going to put the tension back against our hands, and she's going to be tightening the muscles in the back of her neck area. And just let it relax, okay? Now, this is a very simple exercise to do. Again, I have to stress this point. If you have any neck pain, you need to see your family chiropractor. If you don't have one, check one out on our website. It's very important to make sure that the area is stable before you start doing these stretches and strengthening exercises. A lot of times I see people with herniated discs or severe subluxations in the neck. That needs to be corrected. Don't always think you could take a couple of painkillers and just stretch or exercise past the pain. You could be causing more damage, okay? Thanks so much.